Hello, everybody. For those of you who maybe have seen some of our Summit series in the past, we welcome back Jo Anne Fawcett. She is the owner of Pure Health Clinic in Toronto. And Joanne, she's a massage therapist. She's a movement and mindfulness specialist. So she brings a bit of a different area of expertise to our Summit series here. And her bio is great. She works with women who know taking care of themselves is the key to slaying their goals. Right on. Professionals, mothers, and partners whose superpower is just getting stuff done. With 22 years of experience in massage therapy, exercise, nutrition, and mindset training, she is a self-proclaimed stresspreneur. How many of us could use some stress support? Business owner and mom. I get what you're going through, and she's founded a clinic, the Pure Health Clinic here in Toronto, to support you through this crazy cortisol-filled ride called life. No sleep, no carbs, and no weight not lifted can drive us into the ground, and she is here to lift you up and get you back on track. Let's do this. Discover what natural health solutions support your brain and body so you can bring the best version of you to life. So welcome back, Jo Anne. It's a pleasure to have you again. Today we're going to be talking more about injuries and prevention. So Jo Anne, are you a stranger to injury, or have you experienced them yourself?
I know, yes, I am someone who, with my running, goes through IT band injuries. And I know a few people nodding right now. It's a very common runner's injury. And it made me think of a kind of funny story, because I can't talk about injuries and not bring in foam rolling, and that's going to make everybody cringe. They're like, I hate the foam roller.
Yeah.
In particular on the IT band. But many years ago, when I first started my training for increasing my distances for a marathon, I got my first IT band injury, and it really can be painful on your knee. And I thought for sure there was something else happening. And I was like, oh, this is what it's all about. This is what some of my clients have experienced. And I got to the physio, and I started, I did about 10 cringing and making all these faces. And I couldn't believe the degree of intensity of pain foam rolling that IT band. And I got 10 down, and the physio looked at me and she's like, how many have you done? And I was like, oh, 10. She's like, oh, talk to me when you've done 30. Like, no crying at 10. And I was like, oh. And so I do remember that every time I tell people, yeah, you probably have your 40, but I know you'll cry. I know the big thing is, though, I think the key is most injuries that we come across in running that are muscle strains and pains and overtraining injuries, we don't have to stop running. And I think that's the biggest kind of encouragement I can give people. Now, it's, not every injury, of course, you need to make sure you go and get things checked out when you're starting to feel pain that's stopping you from your training. But when we're talking kind of overuse and muscle strains and pushing our muscle to, especially during our hill training and strength days, our speed training, we're really pushing, we're really gaining strength. And so that tear and repair process is happening, where we're slightly injuring the muscle in order to repair it to become stronger. So, you can kind of guarantee you'll ebb and flow into some aches and pains and injury throughout your training protocol.
So when you were training for your marathon and you had that IT band injury, did you end up stopping, or were you able to make some changes so that you could continue?
It definitely did sideline me for the first time, and I realize now that I was feeling it, but didn't realize what it was. I was feeling this dull ache in my knee, and I'd run, because as you vary your lengths, I could do shorter runs. I could do 10K runs and be okay. It wasn't until I was pushing a little bit more distance. And so the thing that I find most important to tell people and express to people is how important it is to really get a sense of your own body and pay attention to your body when you're starting training. How does it feel? We track so much information on our pace and our distance and our running routes, heart rate, but we really need to also just jot down, like, I felt good after that run.
Yes.
My left leg hurt a little bit. It took longer than my right leg to recover. I, couldn't sit down. That's always the
Yes.
joke. People need to install the bar in their bathroom. Yes, it's too hard to sit in the toilet.
Oh yeah, the sidebar. To brace.
Right? Help me.
Oh my God.
The muscles get so sore. But,
Yeah. That's a good thing to track. I know I use Runkeeper as one of my apps when I'm running, and at the very end it says, how did you feel? It has like a series of like frowny to smiley faces going from like a 1 to 5, so you can rate it, but then it has like a little comment box. You could put those comments in there, and if you start noticing hurt knee, tight IT band. And for those of you that don't know, where is your IT band, Joanne?
Oh, your IT band, yeah, that's great. It runs on the outside of your leg from your hip joint. So if you're running your hip joint to your knee. And
Okay.
the key, and I know this is a bit more specific for women in this series, is that because we have wider hips, we call it a Q angle. The angle from our hip down to our knee is comes down. It's not quite as narrow as often for men, for their the angle from their hip to their knee. And so it's that slightly increased angle that sometimes contributes to more tension there that gathers. And the IT band is meant for stability. It's not a muscle. It's a fascial band, which is thick tissue, which is helping keep the structure. It's helping our hips from sliding out when we run. So its role is to hold tight. But what happens is the muscles push up against it as we gain strength, as we gain blood volume, as we're increasing the size. It's kind of pushing against that band, and that band starts to try and pull us back into the alignment we had when we weren't running. So on our day-to-day walking.
Okay.
So there's also just a growth and growing factor as we increase our distance and strength and training. That will kind of ebb and flow as that band will resist, and then it'll start to release and increase with you with your strength gains. But then it'll start again to resist. So it's very common, but the good thing about it is it doesn't have to stop you from running. It might sideline you for a little bit for the pain. You do a lot of foam rolling. You work with hot and cold. You can get massage. Therapy is great. Physios have different strategies. There's fascial release techniques that work really well that you can find therapists. A lot of massage therapists do it, but a lot of physios do as well. So if you find, and some people just specialize in fascial release.
Yeah. So for you, your symptom was your knee was hurting because that band comes down and attaches by your knee, and it was tightening and kind of pulling the angle of your knee off, which is more common in women, right? So that tracking of the kind of patella, the kneecap going over top of the joint might be off a little bit, and that's where you're experiencing your pain.
So much the patella as the IT band crosses the joint line. So where the joint's opening as we're running, it's flexing. So at our knee, so it's more on the outside. So the pain radiates towards the patella, but it's actually that repetition of the joint line opening and closing that's irritating the point of insertion. So you have to slow down a bit. You have to pull back. And one thing that we had a little quick conversation about that I think is really important for people to track. If you have an injury now, or if you've had one in the past and you're trying to prevent it for any of your training coming up, the two key things I think are duration and intensity. Those are metrics you can think of yourself, and that gives a really good guideline to any therapist if you have to go to let them know where that pain cycle is. Because for experiencing pain, it's a very difficult thing for therapists. We always say you don't want to chase pain, because sometimes pain radiates away from the point of where the problem is. But if you can track and like one of that app, that's great. If you have the little notes and say, oh, I did the same distance, but it was less intense than I experienced yesterday, or create that scale, the 0 to 10 pain scale for yourself that you really can key into and know, 10 is I can't walk at all. Like I'm not moving this joint or this leg again, to like 0 being completely pain-free, and find that rhythm in between. Because when you adjust time, your duration, you can often control that intensity. So sometimes with an injury like the IT band, it may be you just have to go out and test. Maybe I can run 3K today and be totally pain-free. Somewhere in between 3 and 4, I'm starting to feel that pain come in. Then you just shut it down, because you don't want the inflammatory process to take over and sideline you more, but it still allows you to get out and get movement, because when we move, we bring blood flow around the body, and that's what really helps with healing.
Okay.
So circulation is helping, actually, to a certain point, reduce inflammation, and then there's that point where we cross over, and now it's creating more inflammation. It's encouraging the inflammatory process, but there's no reason you can't work within that pain-free zone. So matching that intensity and duration is a really important factors to look at as runners and to track.
Okay.
Does that make sense, right?
Yes. Yeah, absolutely. So shifting the intensity and or duration can
Yes.
give a little bit of a break on those tense, sore muscles.
Exactly. And
Okay.
The growth process for muscles is always slightly injuring our muscle in order to repair it stronger. And that's a concept that's really important to remember as you're going through the training process, because a lot of people get a lot of fear around pain that's going to stop them or sideline them. This is some game-changing injury that they can't do, because the pain can be intense. Pain of acute inflammation can be overwhelming and intense in an area, especially if it's something you're not used to. You're going into pushing yourself into distances and times that is new for you.
Okay.
But it's tracking that so that when you can slowly get back, and maybe if you're in the middle of speed training for a week, you have to slow down your speed. You're not going to meet necessarily goals, but you can still get out on the track and run and keep the blood flow and circulation and that movement going through all the other muscles, and keep the circulation and blood flow happening. But you're just going to watch that intensity. In the gym, sorry, you're going to say something?
No, I was just going to say, so that pain may be a sign of a growth phase with your muscle, especially for somebody who's never experienced any kind of that musculoskeletal soreness. But it would be a good idea to have any sort of pain or injury checked out by a professional to make sure it is one that is suitable to maintain some sort of usage versus one that, you really got to just lay off and not use that at all.
Yes, that's a great point, because sometimes we're just getting, it's just an overtraining factor, right? We're pushing ourselves hard, and it's a slow incremental increase in soreness, the muscle soreness we're experiencing the next day. And those things can, so I'll divide this a little bit. Muscle soreness, because you're feeling you're getting strength gains, is great. Things that can help with that are Epsom salts bath. That's something that's fantastic for muscle tension. So what Epsom salts does is it's a magnesium sulfate, and the magnesium is very alkaline. And we get in the bath, and the key with the Epsom salt bath is you have to have a hot bath. You have to feel your forehead sweating. You have to be hot enough. If you just get in a tepid water, just a warm bath, we won't sweat. It's the sweating that creates this osmotic pull, which helps the acid alkaline between our body and the bath start to normalize. And that's what helps your body actually just recover on its own. So it brings our muscles back into a natural state of what we call homeostasis, which is a balance. So it's a great tool to let the body recover itself.
So would you say to do this bath after an exercise or on your rest days?
You can do both. A lot of people love to do it on their a hard training day. If they have an easier run, they might wait. You can do it as often as you want. I don't think there's a way of overdoing that bath. So if you have the time, it's great. But yeah, definitely after long runs and on recovery days, you want to get in there and just help the body rebalance itself. When we sweat, and this is part of as well the process, is all of a sudden we're now pushing our body, especially in the summer. We're sweating a lot. We're losing a lot of hydration. And a lot of our minerals are the sodium, the salt, and potassium, and these inorganic minerals that our body needs for kidney functioning, for just regular functioning and hydration. And so it's important to especially coming up into the summer months, that we rebalance that and give the body, drink a lot of water, sit in the bath, give yourself a good 15 to 20 minutes, but make sure that it's hot enough and that you're feeling a bit of that moisture in your face to know that you're actually sweating, because you can't tell when you're in the water.
Yeah.
And that you let yourself soak for a good 10 to 15 minutes, but also that's creating sweating.
Okay.
So on top of your workout, so make sure you hydrate. That's the other really key with Epsom salts. If you want to do Epsom salts, it feels good for you, keep hydrating as well.
Okay, so how much of this Epsom salt would people be adding to the bath?
I say more isn't better. So I suggest the average tub, you probably just need a cup of water. You just really need the water to turn. Generally, our water is pretty close to a neutral. So you just want to slide it to pH anyway. So you just want to slide it into slightly alkaline. It'll turn alkaline. So the general recommendation is 1 to 1.5 cups. If you happen to have some super huge, super awesome tub, maybe add the extra half cup. But a regular size tub, 1 cup is totally fine.
Okay, and Epsom salts are super easy to find.
Yes, and a great little tip is, the drugstores all will have them, Epsom salts, and a lot of the natural health stores. But Epsom salts is used in gardening, and the garden centers, I know because of the alkaline aspect, they can change the color of plants, like the hydrangeas. They can be pink or blue depending on the acid or alkaline in the soil. So garden centers usually sell it for. If you're close to a garden center, you can go. You usually get a really great deal on Epsom salts, a little bit more than.
Oh, that's great. Yeah, they probably have nice big bags there too.
I know.
Good tip.
On a different for a totally different reason, but it's the exact same. It's the exact same salts as what's packaged up. Yeah.
All right. Awesome tip. So what else can these guys be doing to help prevent those injuries and
yes,
heal the ones that you have?
Which is the one that nobody likes, but it works so well, is getting in a cold tub. Which, I know, but the reason what you can do, and if you happen to be going to physios, some of them have cold baths, and not that I suggest you getting into a nice bath necessarily at home. Nobody wants to do that, but what you can do in the morning is to really do a cold, warm, cold, alternating shower. And if you start just lukewarm, but you got to think of it as like jumping in the lake. Just try and give yourself, start with like 10 seconds and then try and hold yourself, if you can, a minute in a cold shower, and then you can twist it and get it warm and get that contrast. It really helps specifically in the morning, because a lot of inflammation starts to occur, a lot of cellular repairs happening during the night when we sleep. So inflammation is a little more active first thing in the morning. And that's when, if you can get in your morning shower and do that on a regular basis, it really helps to mitigate that inflammatory process, and it helps you'll heal through injury quicker, and it'll also help in the prevention of injury as you're in a strength building phase. So cold, always good on acute injuries too. If you come home and you have any swelling anywhere in your body, around your ankle, your knee, for some reason, you want to put cold for acute, going back to those very basic rest, elevation, ice type theories. What was it? Rest. Ice, compress and elevate. That's kind of your best for acute. If you see swelling though, then you definitely suggest that you go and have joint injuries and that looked after, right? Like go get it assessed properly so you know what you're dealing with.
Absolutely. Yeah, so with the contract showers, I usually have my patients do it at a 3-to-1 ratio. So 3 seconds warm, 1 second cold, and then repeat it 3 times and finish on cold. Is that what you do with yours?
Yes, I think you can. That's a great ratio. I usually just say as long as you can tolerate the cold, but I definitely agree you need to end on the cold.
Okay.
That is important, because that's so when you're changing your body temperature, you're helping the blood flow get around. You're kind of causing this dilation and constriction of the blood vessels that helps pump more blood and oxygen and nutrients in throughout your body. But the cold helps kind of seal down and compress the blood vessels, so you're not creating a lot of pumping through. If you get into a really hot shower, sometimes it feels good, but what you're opening up is all your vascularity, and it's pulling to the surface, to the muscles. That's why it looks red sometimes on your skin. And
Okay.
sometimes too much blood flow into an area where there's injury, and you're actually going to increase the pain that you're feeling.
Okay. Yeah. Good point. All right. Yeah. With the contrast showers, they can also help you thermoregulate so that you're a more regular body temperature throughout the day. They can help support your immune system, and they also help metabolism, and they make your hair like nice and shiny after too.
Yes, no, it really is. And that was traditionally, you look back at, Finnish spas, and a lot of spas were based on this hot cold therapy. And now around Ontario and Quebec, we have a few of them, the thermal spas that give you that option. Actually, if you're people training, you can do that down at Body Blitz.
Oh yeah, great. Yeah, Body Blitz is in Toronto.
Mm-hmm.
Yeah.
That you can
sometimes you see it. Body Blitz is funny. For those of you who don't know, they have a series of pools, hot and cold, and saunas and steam rooms, and you're supposed to do a whole circuit, but you'll see quite a lot of people avoiding the cold pool. But you really want to get into that cold pool. It's the contrast is going to make you heal and feel better.
Yes, and I do always equate it. It's like, jumping off the dock into the cold water that first time you jump in the pool.
Yeah, those Canadian lakes.
Yeah, it kind of, you get it's a rush. It's good. I know at first you hate it, but the more you do it, I don't know if you agree, but the more you do it, the more you actually want to do it. It's actually kind of addictive because the feeling is so good.
Absolutely.
It really does help your body. And I know everybody thinks we're all crazy right now for saying that, but it's really true. If you try it, just make yourself do it the first week, won't be pleasant. And then all of a sudden you'll be like, just doing the warm won't do it for you anymore in the shower.
Any other tips, Jo Anne?
Yes, the other thing that can give the going on the spas, but there's a lot of great heat. Anything that does, if you're, so the trick here is kind of knowing whether you have muscle soreness, and this, again, you may want to come and see a massage therapist or a physio or a chiro. If it's muscle soreness from the normal strength gains, heat is still good to get into a hot tub where the water's swirling. The one thing with moving water, which is really great, is I don't know how the measurement was done, but they were able to measure the pressure, and it's very similar to lymph flow. So when you sit in a hot tub and the water's swirling around you, it actually it helps lymph move through your body. And lymph is it's a system that runs, it's a passive system that runs along with our blood vessels. And it carries all the congestion and when on a cellular level, when we're gaining strength and we're exercising a lot, there's cellular waste. Some people say, toxins. It's a normal, dead cells, replenishing cells, new cells. It's part of the growth cycle. And they get pushed into the lymph system. And then it's through circulation that helps passively pump them up. And they eventually go into our blood vessel and get peed out.
Okay.
But that going into water, the circulating water, can be really beneficial and helpful. So if you have, or a friend has, a hot tub you can jump into on a recovery day. I wouldn't do it post exercise necessarily, or you have to give yourself a few hours, 3 to 4 hours at least, for your body temperature to regulate after you've done a workout. Okay. And so that you're going into the heat at a normal body temperature. That's helpful with recovery. And also infrared saunas, they're becoming much more popular. So that doesn't have the water aspect, but it's that low grade, slow increase in heat, which helps on a metabolic level with cellular recovery as well. So those two things are great for that muscle soreness that comes with just your normal increase in strength, and not necessarily an inflamed joint or a torn muscle.
Okay.
Yeah, I find can be really good. I was just looking what, and again, with thinking of the strength, like bringing it back to, I know I spoke about it, but when you feel that soreness, start that measuring of your intensity and duration so that you know that it's pulling back, it's getting less, like that you can go longer with less intensity.
Okay.
So they're kind of opposing. You want to keep adding the duration without the pain.
Yes.
So that you can have a really good measure of that pain cycle. And then maybe you find nothing's changing. Then again, that's a great time signal to say, go get it checked out further.
Okay. Okay. What about progressive relaxation? Can that help?
Yes, thank you. That is a great suggestion. So it's both in the therapy world and in the meditation world. Going to bed at night or after you're done a run, a great thing to do is to lie down. And I start with the feet, and you want to tighten all the muscles up. You can start it progressively from the feet up to your back, or do your whole body at the same time. Where you want to really tighten, you tighten into fist. You can make your face like, you just want to make everything extreme,
Yeah.
right? Tighten everything from your face, your, chest, your back, feel your shoulder blades coming together, your glutes, your butt, your legs, your the bottom of your feet, curl them up, clench your toes and hold it and feel like you're doing a maximum contraction. You're tightening as tight as you can, your whole body, and then let go. And
Okay.
then, and you want to do that. Let the release last a good 30 seconds. Just
Yeah.
feel your body. What does it feel like? Is often you'll start being able to identify this. I suggest doing it 3 times in a row.
Okay.
And you'll start finding the signals around your body where that soreness is lasting. So sometimes it's surprising. Sometimes a bicep or your shoulder, or it could be down in your calf, is more sore than the other muscles which aren't sore at all. Now you can do a little bit more work. You can focus more on stretching out that muscle. Also, always hydration whenever the muscles are tense, adding in some hydration, but you can focus a little bit more on some stretch and specific moves. Foam rolling, again, great. You can foam roll the whole body. There's so many great videos online to show you how to foam roll the inner thighs, the outer thighs, the IT band, your quads, your calf. The other great thing is we often put 2 tennis balls together in a sock, and you can lay back of them and let it come up and down your spine on both sides. You can lay your calf on it when you're just sitting on the floor, and let your calf with just your normal leg weight come down on the balls. And you can feel those trigger points that you often feel when you go to massage or when you're in a physio session, those points that kind of increase intensity. But if you let them hold and breathe into them, they'll also just start to resolve and to let go.
So
And
would that be a form of self-massage?
yeah, similar, yeah.
Okay.
You don't have to move it around necessarily. You can keep them in one spot, but also you can lean up against a wall if it's your shoulder blade, or lie down if it's not too intense, the discomfort that you're getting when you put the ball on the back. But it does help release tension.
Okay.
And it's also, oh, sorry.
When doing it on your back, would you want the ball to be right on your spine or on either side of your spine?
No, great point. Thank you. You'd never want to go right. You don't want to put pressure on any of the bone or joint. So put it on the muscle along the side of the spine, and you should be able to feel it. You kind of feel that point. You can move yourself into it and know, oh yeah, there it is, and just hold it and relax and breathe. Makes me think of one thing as we were talking about the spine. Another really important factor for both injury care, but also just general recovery, is to use days off to move in ways that are different than running. So when we're constantly training our muscles into a pattern of movement, we're always running straight ahead, or, whether it's being speed or hills or whatever, we're always in a similar plane of movement. It's really great and regenerative to the whole body to do it through an off day, a yoga class. If you don't like yoga, try a Tai Chi video. That's also another good flowing, non-intense movement, is really helpful to release tension patterns in the body. And we're naturally trying to grow, because that's our goal with the running, those tension patterns. But we also are working, and we have kids, and we're doing a lot of other things where we're bending and lifting. And if we have small kids, we're lifting and carrying a lot. And the back is, our legs and the big bulky muscles like our biceps and our calves and legs, those are muscles that move us. Our back is postural. So it's working all day when we're sitting at the computer, which is, when we're sitting at work or sitting in the car during commuting or traveling, and it's creating tension there. So sometimes we don't think of it as, why is our back tight when we start a run, but it may be because you've actually been sitting or the position you were sleeping in. So adding movement in on non-run days, on those recovery days, is really valuable and important to help release those tension patterns, and it'll also release a lot of the pain patterns and be very preventative for injuries.
That's Fantastic. Yeah. So for those repetitive motion injuries, switch up the type of motions that
Yes.
you're doing.
And you know what my key is, it's switch up non-intense. So I don't want to switch up and start doing a lot of weight training on a recovery day. You can add weight training, that could be part of your training schedule. But I just, on a recovery day, you don't want flowing movement. You just want movement like a hatha or restorative yoga. Don't go into Ashtanga, which is like a power yoga. You want to go into classes that help you with flow and movement, and you're opening your joints. You're trying to lengthen things out and remove tension and pressure, so that when you start your run, you start it, you're not tense when you start your next training session. And so it's, side bends. The other great thing is rotation. Something that we often never do when we get into running patterns is just sitting in that with the leg crossed, rotating our thorax, our thoracic body. And the name has escaped me there's a couple of yoga poses, sitting twist.
Okay.
Those are great. Add rotation in to your day whenever you can, even if it's just a light swinging back and forth. There's a lot of Tai Chi and martial arts moves that open up Qigong, and they're just swinging. You're just swaying and moving arms side to side and tracking with your head. So you're moving your head with your arms. And it's just a slow flowing movement, but it helps release a lot of the pressure and tension on your spine.
Okay, yeah, that'd be great for people that have desk jobs as well, who are sitting for large portions of their day. Open up those joint spaces and move a little bit.
Yes, and it's a great thing even during your run. When I often tell people, you're at a traffic light, you're standing for a moment, you get forced to stop, just do a couple of little swings. Help your spine get out of that super tense position so that you can just open up and let your shoulders drop.
Okay.
That's one of the things as well for nutrient recovery, for getting nutrients in and blood flow around. We need that circulation. We also need the oxygen from our breath. If we pull up and come forward, where you see people really leaning forward in the run, we compress the amount of space our lung has to get oxygen in. So the more we can stand tall and open and have our spine mobile, it gives our lung so much more capacity to pull in oxygen, and we actually get tired less quickly. So what fatigue indicators is we start using our shoulders to pull up our spine, because our body wants it. We want to get oxygen into our body. And when you see people running so curled over, the best to do is that actually wastes energy.
Okay.
When you stand back up, it allows your lungs to get, each breath you can get more oxygen through. So that's another thing in the kind of training and recovery. When you're getting to fatigue states that are too much, when you can't run standing tall in that good posture and you're feeling yourself curl too far forward, you just want to give yourself, cut back again on that intensity and duration a little bit until your body has a chance to have some recovery from that fatigue.
Yes, being mindful of your posture, that's huge. I notice for myself when I start getting up into distances over 10K, and if I start to get a little bit tired, I start to stick my neck out while I'm running. And that I'll get a headache if I run like that.
Yes. Yeah. And a lot of that is because we're not always, it's not easy to be aware of the tension that's accumulated from our day's work, right? Or the way we've slept. So even if you run in the morning, sometimes that helps. You're less fatigued, your back is less fatigued, but it still can be. But at the end of the day, for sure, our postural muscles can be just through work, even though you feel energized and good, right? And so but you're right, being really mindful of that is a great indicator to ourselves of being that, growing that self-awareness to say, it's time to pull back and just maybe end a few blocks sooner than we normally would, right? You'll get to run in. Or what I often say to people, if you're starting to feel it, switch. If you have the gears, if you're conditioned runner, I say, then just change up your route and go shorter and a little faster, right? If you feel like you want to get that good, it's more kind of runners who do races regularly that'll be something they can do. And runner, that'll be a challenge, but don't worry, that's okay.
Or going the opposite direction can make a difference sometimes.
Yes. Yeah.
All right, so just to recap some of the tips that Jo Anne used to overcome her IT band injury that can relate into your prevention and musculoskeletal care. One, we've got you don't always need to stop running. We may just need to switch up the tempo and the distance for our runs to get through that natural state of muscle breakdown and building, but always have it checked out. Switching up the type of exercise you're doing on those off days so that you don't fall into that repetitive injury stage and you're using more of that like opening up the joints in the musculoskeletal system as opposed to slamming it with another type of exercise. I really like the track your feelings, track that sensory patterns, those pain cycles to see if you notice a pattern, because when we're not in pain, we forget. And when it comes back, we're like, oh, right. And then to have that tracking system can help us notice some of the patterns that are starting to fall into place and can urge us to go seek care or to implement some of these self-care techniques before it becomes an injury that takes you completely out of the game. The Epsom salts in a hot bath, so you're getting that sweating factor, can help you recover. We've got the progressive relaxation, so holding for about 15 seconds, relaxing for about 30 seconds, repeat that 3 times and use it as a body scan too to create an awareness of where you're feeling that tension. With the contrast showers, so 3 seconds hot, 1 second cold, repeat 3 times, finish on cold. The saunas or hot tubs, doing those or the hot tub at least 3 to 4 hours post exercise if you are going to do it on the same day as exercise, and just using those intensity and duration pain metrics, I think are huge. So Jo Anne, where can people find you?
I have a clinic at Yonge and St. Clair in Toronto, and our website is pure-health.ca. So yeah, if you're local and have an opportunity, please send us a note or come by. And one of the gifts we'd like to give for people is to come in and try some movement and meditation strategies to help, and we can get them more individualized for your goals, depending on if you're a new runner or you're a more competitive runner and have some personal bests that you want to do or specific goals. We can help with some visualization techniques and strategies, and also work through this progressive relaxation and body scans that are really helpful for recovery and meeting your goals.
Oh, that would be great. I think people would really benefit from that. Thanks for that offer, Jo Anne. So once this summit is over, you guys will have access to her awesome offer there, and her website information will be there as well. So thank you, Jo Anne, and take care, everyone. See you at the next summit.
Yes, absolutely.